been getting worse. I've been going through it.
Okay.
Going through
Which
it.
is one of the things. So with discoid lupus, you know, it's a condition where it affects your immune system is attacked, right? Mm-hmm. One of the triggers for discoid lupus, which is the type of cicatricial or scarring, because there's two types. There's discoid and there's systemic. Discoid shows up as scarring, where your follicles are inflamed and then eventually they burn out. They have hypo or hyperpigmentation. Sometimes you'll see red patches, sometimes even on your skin, other areas of your skin, you'll have red patches.
This happened and it's not red anymore. I thought I got bit by a mosquito.
Yes.
But
yes.
It was red and it looked like
yes.
I had a rash or
yes. When it starts out red. Sometimes you may even have butterfly pattern on your nose, or that even spreads out to your cheeks.
They used to call me Pikachu.
So clinical features, right? Clinical features means these are the obvious features associated with this type of disease or disorder.
Gotcha.
So discoid lupus is considered a disease. So when clients come in to see me with clinical features, because I'm not a doctor, right? So I'm not supposed to diagnose, and I'm very careful to not step out of the realm of who I am, right? So if someone like yourself comes in, I start to do my consultation. I have a very comprehensive consultation form. The client starts talking to me about red patches on the scalp or on the body or on the cheeks. It'll make me dig deeper and ask further questions, and that'll lead me to what I suspect. But even with my suspicions, I don't say, as a trichologist, you have discoid lupus. Now, in my heart of hearts, I may believe that is what it is. But because I do understand being a doctor and a trichologist and the difference, my conversation with you would be, I think you should go to the doctor, have them do some testing. It appears you have some clinical features associated with discoid lupus.
Okay. Yeah, these last couple of months have been crazy rough, and so it's been more like inflamed. It feels active.
Yeah.
Like these, I don't feel nothing. I don't feel anything here, but it's a little sore there.
And I kind of went off topic when I went on about discoid lupus, but it brings me back when you said what you just said. I've been going through it. One of the causes that they believe triggers an autoimmune response, which triggers the cicatricial scarring, is stress. But I have this chart over here.
Let's grab it and move it. Let's see this.
Let's look at this chart. I call this the brain of the hair follicle. This yellow line represents your sympathetic nervous system, which is what's triggered when you're in a very stressful state. So you're in that flight mode. And when you're in that mode consistently, like your body responds to that. And so you're saying you've been going through
like fight or flight? That's what you mean, flight?
Yes. Ooh. Yes, absolutely. So now your body has been in that flight mode for quite some time. Your body is responding to that. And you're having what I consider a flare-up. When you start to feel tenderness or warmth or itching, those are signs that it's active now. It's inflamed. There's some inflammation happening.
Yeah. And this is what it looks like, and if it can grow back or not, but it looked crazy.
Let's just look. Let's just see what we see. Again, you spoke about whether it grows back or doesn't grow back. So with discoid lupus, it's considered cicatricial. Cicatricial is scarring. And when you have scarring, that means the follicles have been destroyed, and typically the hair can't grow back. However, and it feels smooth.
It feel like a baby's butt.
It'll feel like a baby's butt.
Yeah.
Especially, and I can see that here. So you can see it's getting darker, so you have some hyperpigmentation there, especially in this area. other clinical features of discoid lupus. So what our aim as a trichologist is for you is to prevent further loss. Okay, if it's been inflamed, follicles have been destroyed, maybe not all the follicles in that area. The other thing we do when you have a consultation, which we'll have to most certainly get you in to do, is look at it with the trichoscope. And what the trichoscope does, it helps me to see what follicles are there and which follicles are present and which follicles are not. Because you can have scarring in a particular area, but then still have follicles intact around it. Many times I've had clients come in with cicatricial or scarring alopecia, but we're still able to address that and fill in the hair enough around that area with the hair follicles that are still intact. So what's ideal is to address what is causing, so root cause. Let's just say right now, stress is what's triggering your flare-up right now. Our aim is going to be to reduce the inflammation that's being caused by the stress that's happening, and then address inflammation in the skin. You shared that your doctor gave you a topical, probably was a steroid. That's usually how they address inflammation in the skin. I take a holistic approach to hair loss and scalp problems, so I have other things that I use to address inflammation in the skin, but that would be my goal, would be to prevent further loss. Gotcha. If there's scarring in that area, it's happened, it's done. Or if there's hair follicles that are still intact in that area, to make sure they grow in strong, they grow in thick, they grow in full, so it may camouflage the area where the follicles have been lost. So sometimes clients won't come in for treatment thinking that, oh, you know, I mean, it's gone, it's gone. That's not always true. Each hair grows out of its own follicle. So maybe there's follicles that are still inflamed but still intact.
Because I can feel the difference. There's a little fuzziness, I got a little baby hair action.
Yes. So that would be the goal, would be to those where the inflammation is present, to reduce it. You can't trick your body, right? You can't put something on topically to say help, help with the inflammation, but you don't deal with why your body is in that flight mode to begin with. So many times, clients come in and we get real deep in this room and we get real emotional in this room. And I have a Rolodex that includes therapists, pastors, and everything. Why? Because depending on what's got you in this flight mode, we have to address that. Because I can give you something topically, I can give you something orally that's going to reduce the inflammation, that's going to help the hair to grow. But if it's trying to fight your sympathetic nervous system that's in that flight mode because of this or that issue, you're not going to be effective with treatment. We have to deal with root cause.
That's deep. I feel better now. I feel a little relieved, even though it's like I don't want to hear the truth.
Yes.
But it's like when I do, it's like I feel good. So I'm like, I at least know
yes.
where to go.
Where to
instead
go.
of just trying to hide and all of that. So, okay. I know I need to really hone in on, for what I can control is,
yes.
for right now, is making sure that I'm chilling and
yes.
I'm relaxed and figure out how to get out of that flight mode. So,
yes.
Okay.
All right.
Let's go. Make it happen. Let's
make it happen. Let's make it happen.
And we gonna
make it happen.